Amber Canoy here for Everyday Kentucky, visiting Solutions Functional Medicine once again with Mandi Snell. We've talked about a lot lately. Now we're talking about progesterone.
Progesterone. So there's so little information about progesterone out there. This is one of our favorite subjects at Solutions. Actually, we think of progesterone as the pregnancy hormone. Progestation, progesterone is where its name comes from. And it's really something that's quite underutilized and misunderstood in women. We think of progesterone as the birth control hormone. Well, actually, birth control does not contain progesterone at all. Birth control is a progestin, which is a synthetic that is not the same molecule as progesterone, and it has very little in common with human progesterone molecule at all. Completely different, but they sometimes are nicknamed that. This is an important distinction because we think of menopause as a fifth decade issue, right? The North American Menopause Society says that the most common age for menopause is 51 and a half. But really, menopause is the name we give to the day when estrogen is extinct in our body. The truth is a decade before that, we lose progesterone as early as age 40. And a decade before that, we lose testosterone at 1 to 3% a year. So we have 2 decades before menopause where women will start to experience brain fog, anxiety, depression, weight gain, inability to lose weight, constipation, dry skin, fatigue, low mood, low motivation, poor mental focus, poor memory, low libido, joint pain, insomnia, all before the hot flashes.
Getting all this done.
Yes. So when women hear that, they realize, oh, that might be my story too. And it's not a matter of if this happens to women, but it's just a matter of when. And so the symptoms of progesterone deficiency, or progesterone hunger, sometimes we call it, are so profound. Progesterone is a good mood hormone. And when women after age 40 and they stop ovulating, which is where their progesterone is sourced, they start to have insomnia, they start to have heavier periods, and their mental health may be a little off the rails. How many times have we been placing clients on antidepressants, for instance, when merely they are progesterone deficient? We love to talk about progesterone and its healthy use, and we love to help encourage women, even those low-maintenance ladies in their mid-40s who don't need a lot of pats on the back to get life done, can really be vulnerable in their mental health after they start to lose their progesterone. And it can be a trying time, and we would love to teach you more about that at Solutions.
So it sounds like hormones can play so many roles into a lot of those symptoms that you mentioned. Yes. So it's getting really good data on what's going on with you to know which one's kind of the culprit.
Data is so important, and education is more important than that.
All right, give them a call or go online.